Hi, welcome to JH Backcountry Health. My name is Dr. Tyler. Today we're going to go through an overview of the different techniques that we use to help you feel better. We may use some or all of these techniques on any given visit. As part of our exam, we direct you through various ranges of motion and movement patterns, carefully observing and noting motion dysfunction and asymmetry. We will also use orthopedic tests as needed. All this helps us accurately diagnose and treat your ailments. It also allows us to prescribe exercises to enhance your care and to prevent further injury. Active release techniques make up the majority of the muscle work we do. It is a movement-based technique to release muscle knots and other adhesions or constrictions in soft tissue. Compared to a passive technique like massage, the active nature engages your brain to enhance neuromuscular communication and control. It also has the advantage of using the body's natural system of reciprocal inhibition. To use your triceps, for example, inhibits the activation of the antagonist muscle, your biceps. So I have you activate your triceps, allowing me to work through your biceps when they are in a relaxed state. Pretty cool and very effective. Simply put, adjusting is mobilizing a joint and putting it into the correct biomechanical position so that the joint can function properly. That popping sound you might hear during an adjustment, though there is still more research to be done, it's generally regarded to be the popping of gas bubbles in the synovial fluid within the joint. The sound, called a cavitation, occurs when the joint is stretched, like when you pop your knuckles. Sometimes a joint cavitates when it's being adjusted. Sometimes it doesn't. The sound isn't critical to the adjustment. The important point is the restoration of movement and function. In terms of adjusting methods, we use diversified technique, flexion distraction, and a drop table, and we also use an activator when needed. You probably won't make it out of our office without some homework. We want you to understand what is causing your pain, and we love explaining anatomy, and how you can continue to aid your recovery. We teach exercises and stretches that will help you heal, as well as what you can do to avoid further injury. As we said earlier, our goal is to have our clients spend more time doing what they love and less time in our office. This therapy uses stainless steel instruments to provide an optimal environment for healing by either modifying physiologic response to injury, such as inflammation, muscle spasms, and pain, or by enhancing components of normal musculoskeletal function, for example, increasing ranges of motion or increased muscular strength. The benefits of Graston and IASTM include release of fascial restrictions, breakdown of collagen cross-linkages, increased blood flow, and possibly an increase in regenerative cellular activity. Kinesiology tape is used by medical professionals throughout the world to treat injuries and improve sports performance. Rock tape turns down the volume on pain by providing a proprioceptive input that interferes with pain signals direct to the brain. It decompresses areas of swelling and inflammation via a microscopic lifting effect underneath the skin and between the many layers that allow the byproducts created by inflammation to be removed more quickly. In addition, rock tape delays muscle fatigue during activity and helps distribute physical stress, allowing the injured area to take less of the brunt. It can be used to treat sports and non-sports injuries, including shin splints, plantar fasciitis, runner's knee pain, and back pain. The rock tape functional movement technique certification is based on the concept of muscles acting as a chain. It addresses applications for pain, posture, edema, scars, and neurological symptoms with an emphasis on myofascial pathways, movement therapy, and performance enhancement. Cupping therapy is an ancient form of alternative medicine in which the therapist puts special cups on your skin for a few minutes to create suction. It is used for many healing purposes, including to help with pain, inflammation, blood flow, relaxation, and well-being, and as a type of deep tissue massage. EMS units run a light electrical current through the treatment area, stimulating the production of enkephalins and endorphins, naturally occurring substances that can dramatically reduce pain. When electrical stimulation is used to produce muscle contraction, it also increases blood flow to the area, alleviating tissue hypoxia, and can help relax chronically tight musculature and reduce muscle spasm. Dry needling uses thin filiform needles inserted through the skin into soft tissue. It is based on anatomy in terms of needle location and physiology in terms of the body's response to needles. Dry needling is a specific, effective medical treatment to restore function and mobility in a variety of musculoskeletal issues. reduce scar tissue, and decrease pain. What you eat makes a huge difference in how you feel and how you heal. We look at how simple dietary changes can reduce your body's inflammation, aid healing processes, as well as help with energy levels. We have select supplements in stock as well, the ones we ourselves take and feel good about recommending.